So I'm a physician. I teach at Columbia University in New York City, and I'm going to tell you a little bit about the science of kindness and why it's important to your health. Just to get started, actually, go ahead and use that absolutely lovely model that we just learned of the poise model. So my purpose is, wouldn't it be great if you felt so energized every day, hopping out of bed to get going with work, and that all people could feel that way about their jobs. I mean, we know about 50% of people don't feel that way, but it would be absolutely fabulous if they did, and it would be very beneficial for their health. So I'm going to tell you more about that. We have a couple aims today that includes, I want to talk about the social dimensions of our health, the costs, and we've already heard a lot of it about burnout, incivility, and disconnection, as well as the difference between social isolation and loneliness that's come up a fair bit. And then we're going to practice, and I would love for you to walk away with one tip that you could use right away in your lives to implement more kindness. And I don't have any financial relationships to disclose as part of this. Um, so I'm a clinician, so I'm about to bring you into one of our clinic rooms to talk to a patient. I've changed the details, so nothing to worry about there. But before I do that, I did just want to say I'm going to, over the next 20-ish minutes or so, share decades of public health research. I'm going to try my best to make it as simple as possible. Some of this will be known to you. I know we have a lot of researchers, some people in the medical field, that are on this call. I just ask for things that are new to you or interesting, jot them down. For things that might be able to help a colleague or a friend or family member, to, if you could also write those down as well. And also, I am a learner and I approach this subject with humility. So please reach out to me if there's something I say that doesn't feel right to you or you have a question about. This is really about creating connection together. Okay, so now we're going to step into that clinic room together. We're going to see Miss S, who, what we know about Miss S is that she's here for a second opinion. She's already been to one doctor that had a pretty extensive workup and didn't find much of anything for her common physical complaints that include headache, fatigue, and some increasing back pain that's not responsive to medication. So, so in the room, when we get inside, the first thing we have to do is double check that we're in the right room, because the patient who's in there doesn't quite look the age of the person on the form. It's who says she's 49. She's looking it's sort of surprisingly older than that, but we verify that is indeed her. And then we start to find out a little bit about her and her life. When we ask if she's got a partner, she laughs and says she's married to work. And then as we sort of dive into her work story, we hear a little bit about a company. She works for a very glamorous company in New York City, where she has worked her way up through the ranks over the years. And the company has had a lot of challenges, a lot of layoffs, a lot of turnover. She feels like her set of colleagues have constantly shifted. She doesn't, to MJ's point, she doesn't have her Leo there. She feels like morale has gotten so low and that people don't know her work ethic. She's got to work harder and harder to keep proving herself. So this means long nights, often working weekends, skipping vacations. The longer we talk to her, the more we realize she's got the classic triad of burnout, which we've talked about, which is the exhaustion, the cynicism, and also the inefficiency in her job, just feeling like she's working harder but not being as productive. So, so it turns out that when we sort of dig deep down, nothing's going to turn up on the imaging or blood work, but she's having a real health problem because her job is actually impacting her on a cellular level. And it's causing her to have these feelings of poor health from chronic stress that we know can cause inflammatory cytokines and cause those behaviors that make us feel sick and groggy and want to climb into bed well before bedtime. So let's talk a little bit more about what are some of the symptoms of an unhealthy workplace, because probably every person on this call has worked somewhere that they would deem as unhealthy. Um, And also, MJ, I'm going to ask if you don't mind, because I am not sure exactly what time we're supposed to end our session. If you wouldn't mind just giving me like a 2-minute warning or something so I can wrap up when the time comes. Um, the oh, so here's some examples of unhealthy workplace cultures. A remote worker who's repeatedly calling in sick, or showing up to meetings with camera off. A weekly staff meeting where participants can barely conceal eye rolls and snickers. And those are really unpleasant meetings. I think we've probably all been in them. Or a junior employee who's sitting at the back of the room just feeling absolutely invisible. So, what if the most overlooked workplace performance isn't some not new high tech platform or revamped policy or metric, but something just really simple and fundamental, which I suspect you all believe because you're all here today. And that's kindness. So, I'm going to share with you a little story that actually ended up being the title of the book that I wrote, The Rabbit Effect. Um, and it goes like this, and it really was it played an important role in my life, and I'm really grateful to it because it transformed how I thought about health. Um, so the story is back in the late 1970s, there was this wonderful researcher by the name of Dr. Robert Neeram, who was interested at the time in publishing papers related to diet and heart health. And so he designed this very straightforward experiment. He was a bioengineer looking at high fat diet and plaque buildups in arteries. And when they did the experiment, they got these really unexpected results. One of the groups that they studied in the lab had vastly different outcomes than the other groups. It was like a 60% difference. And being good researchers, of course, Dr. Neeram figured they'd messed up somewhere on the protocol, but everything checked out. So what was going on? So they looked up from sort of the data and they realized that the researcher that was taking care of all the rabbits that did better wasn't just doing the standard protocol. She wasn't just feeding them and taking care of their needs that way. She was actually picking up the rabbits. She was petting them. She was talking to them. She was eh, completely giving them love and kindness. And Dr. Neeram, who was an extraordinary scientist, thought if this is possible, that somehow the social world is changing the physiology of these animals, this is a huge story. This is something we're really missing when we think about biology. So, to his credit, he redid the experiment and got the exact same results. They published it in the journal Science. And now decades of data have shown that indeed our social world and how we are treated in our everyday lives, including at work, matters tremendously for our health. So we're going to talk a little bit about that. And it also just really sort of turns how we thought about health on its head and takes it out of the hospitals and it moves it into offices, workplaces, everywhere that people are showing up for their third of their lives. So first, how do we define kindness? So I like this definition: an act that enhances the welfare of others as an end in itself. I have been quoted as saying this, and I fully stand behind this. If I could, I would prescribe kindness to everybody. I've never seen someone who doesn't benefit. And the best part is there are all these physiological knock-on effects that mostly come through regulating cortisol in the stress response. So better mood, better sleep, lower stress, lower blood pressure, better immune function. I do have to warn you as a physician, there are side effects, which include feeling connected, belonging, smiling uncontrollably. Oops. So I don't have to tell you this academically because you know this intuitively, just as a human being who's encountered kindness from the moment that you arrived in this world and had your first embrace. So consider an act of kindness something that you have either seen, done, or experienced in the last week or so. And actually, if you're feeling inspired and feeling like sharing, feel free to drop that in the chat as well. All right, hopefully you've got that. But also, I want you to think about how that made you feel in your body. I suspect as you thought about it, you probably felt more relaxed. You probably smiled a little bit, remembering something, felt warm feelings, gratitude, all these good knock-on emotions that actually have a cascade of health benefits um, down the road. So we'll talk a little bit more about that, but that's the power of kindness, and it's instantaneous biologically. So here's the other incredibly awesome part about kindness is from research, we know that it's not just the receiver who benefits, it's the giver and also the observer. So that's the incredible ripple effect of kindness right there. Now, I like to sort of couch all this in the sort of thinking about these social dimensions or hidden factors of health or social determinants of health as we think of them. So, right at the center of this is you. Um, and then we have all these rings of our lives that are impacting our biology in different ways. And by the way, this is not a small effect. It's been estimated to be that medical care, as important and critical as it is for every human body, probably only accounts for about 10 to 20% of our overall health status. And even our genes are impacted by our social environment, as we now understand through the absolutely mind boggling science of epigenetics. We're going to talk about several of these dimensions, but because we're in a conference focusing on workplaces, we're just going to go ahead and start with work. Obviously, we spend about a third of our lives at work, and the data shows that people don't feel great about what they're getting up in the morning to do. They might feel burned out. About a half of workers, according to some surveys, do. About a half of people report feeling burned out on top of it, and there's studies or research from the American Psychological Association that shows work stress is actually the top cause of personal stress in the United States beyond finances and health. And a lot of times it comes down to these interpersonal relationship challenges that we have. Exactly as Jill was talking about and MJ alluded to earlier, those play a really big factor when it comes to our health. So pop quiz. I'm also a teacher, so I like these little quizzes. What's the best predictor of a long and happy life? A, your diet. B, regular exercise. D, good sleep. D, positive social connections. Or E, driving a Lamborghini with Taylor Swift, which sounds fun. But fame and fortune, which is often what we consider the predictors of a long and happy life. But it turns out my computer will cooperate. The answer is D, of course, it's positive social connections. And we know in part from, again, there's so much data, but one of the most impressive studies is now led by Dr. Waldinger, who's in this picture with his partner. It's a Harvard study that started 83 years ago. And what they found totally unexpectedly is the people who were the most satisfied in their relationships at age 50 were the healthiest at age 80. Interestingly, the original cohort, I think, had John F. Kennedy in it and some other well-known folks that started as young people. And the director before him had this to say: when the study began, nobody cared about empathy or attachment, but the key to healthy aging is relationships, relationships, relationships. And of course, this is also our work relationships. We know that lacking social connection is as dangerous as smoking up to 15 cigarettes a day. This is work done by Dr. Julianne Holt-Lundstad in Utah. This was highlighted in the Surgeon General's advisory back in 2023 about our epidemic of loneliness and isolation. And I just want to pause here for a second, because loneliness is the subjective experience of being disconnected from other people, whereas isolation is the physical experience, like the number of people you're around a day. We know that both are not great for health. But the loneliness piece of it, and actually isolation was something, as more work went remote, as more conferences go remote, this idea that we are doing so much online, but we're not always physically around people, plays a role. And then the other thing is loneliness, that we can be sitting in a crowded room at work. Like I think about the young person sort of sitting on the side of the meeting and feeling just absolutely disconnected from everybody around us, and neither is great for health. So two more social determinants that I want to touch on. And I'm sorry, MJ, can you remind me what time we're going to end so I can? I think we have
At
till
1:05.
1:05. Okay,
1:05.
perfect.
You have 6 minutes.
Okay. So one of the big ones that relates to purpose and well-being at work is education. And this is a photo of Nola Oakes. She's the world's oldest college graduate, as far as we know. She graduated college at 95. She then went on to get her master's degree, which she completed at age 98. She unfortunately passed away at the age of 105, but it was after she lived her whole dream of going to be a teacher on a cruise ship around the world. So here's the thing. We know that education, in part from studies, and I'm going to just give you the punchline of some of these studies. We know that education has a profound underestimated impact on health. And education isn't just formal education, it's what we're doing here today. It's what you do in your workplaces when you create learning pods and keep learning about subjects you're interested in. Um, so so they looked at, Dr. Wolf in Virginia looked at medical advances and how many lives were averted compared to education mortality disparities that would have saved lives. And what that worked out to be is a 8-to-1 ratio. So that means for every one life saved by a medical intervention, 8 lives are saved by education. So just that is the social dimensions of health right there. And so also I just want, as an educator, this really rung true for me. And I just want to say, like, as you think about your work, how can you incorporate more education? This I was a slide I was very pleased with myself. We're going to talk about purpose here, not purpose, but when you're making your slides late at night and you come up with these brilliant ideas. Um, so here's Viktor Frankl saying, "Those who have a why to live can bear with almost any how." Um, and what we know is that when you measure life purpose, and there are these metrics that you can use, including this one, that ask questions like, some people wander aimlessly through life, but I am not one of them. You find out this incredible physiological thing that, as a doctor, just absolutely blew my mind, but helps me understand a lot of what I see clinically. And for the clinicians on the call, you will get this. People with high life purpose report better sleep. They have lower risks of getting infections and also getting as sick from infections when they do get them, better cognitive function, and better mood all around. I just want to take 1 second to talk about cognitive function because this is so impactful. And there are studies that show that for people, that prospective studies showing that baseline measures following people over time, that people who reported higher purpose in life was associated with a substantially reduced risk of Alzheimer's disease, like 2.4 times. And I'm just to show this graphically, it was quite remarkable to sort of see this separated out by purpose. And this is not the only study, there are others. But what was most remarkable to me was that when you looked on autopsy of those same individuals that kindly donated and continued on, that what they saw is that even people who had a high burden of disease on autopsy actually those who they lived and functioned better in life if they had a high sense of purpose. So that has to do with our psychoneuroimmunology. And we know that, like we talked about, lower inflammatory markers, which leads to all those good things. So I know we're running close on time, but I have to tell you the punchline here, which is the big question is, does that help you live longer? And the answer is, this was a well-done study that was done in JAMA looking at this. When you look at who has high life purpose, sure enough, you see that stepwise gradient showing that people with high purpose tend to live longer. And according to data from the Blue Zones, which I know has somewhat come into question recently, they showed it could be up to 7 years of health span. Even if they're off by a magnitude, that's really impressive. So here's the thing. Each of you works in an environment. There's tons of opportunities to try to infuse more kindness. You can appoint yourself your own kindness person at work. Number one, supportive work environment, and really thinking about how you show up to that work. and that workplace, that's totally in your control. We know that workplaces that actually people are happy have higher performance. And this is almost like the holy grail of this research to me. It comes out of Oxford, but it shows that actually when happiness precedes success, which is mind boggling, but that means that even in tough moments, we got to be paying attention to this. And I know we're up on time. I just wanted to this was actually, I was really pleased. The World Economic Forum really ran with this idea that we could probably toss out our human resources manuals and just rewrite it as being kind. Um, Thinking about your purpose and thinking about why it is. And I'll leave this as homework for you. What inspires you to do what you do? And how can you tap into that deeper? Because we know there's a lot of unkindness out there. And, it shows up sometimes in ways like little microaggressions that are like death by a thousand paper cuts. But we know there are ways to counteract it. One of the easy ones that's come up many times on this call, including with Jill's call, is can you pause for a minute before you respond and react? And you got to be able to pay attention to your feelings and your needs and to address that. And also gratitude. There's lots of studies that even just simple things like saying thank you to people can have an impact on how they're sleeping at night. This was a study that was done in nurses. So the verdict is clear, be kind. Of course, that's a lot harder said than done. I'm just going to quickly end on this story. And that's the tale of sometimes when we know data, we don't do a very good job of implementing it. This is Dr. Lind, who was a Scottish physician who did what was known as like the first randomized control trial in history, where he figured out that citrus prevented scurvy. Of course, he figured that out. There had been rumor of it back in the 1400s. It was in 1747 he did the trial. It wasn't until a year after his death that that this was implemented into the naval services, and then they changed it from citrus like lemons to limes because they were cheaper, hence the term limey. And it wasn't until 1928 that it became standard of care with vitamin C. So we're looking at 431 years. The data is so clear that kindness not only creates happier workplaces, happier bodies and coworkers, um, but also success. So it's there. We just have to have the willpower to implement it. So I like what Noah Oak said. Set a date to begin, do something, don't just sit there. So I encourage you to imagine a better work future for all of us because we all thrive when we show up feeling our and functioning as our best. So thank you so much. Sorry to be a couple minutes over, but I'm just really grateful to be here all with you virtually in all these different corners of the world. Thank you.
Kelly, thank you so much. No apologies, and there's already requests to see your slides, so hopefully we'll be able to make those available to everyone who's attending. Really great way to help us wrap up the how we started with MJ and came through with bravery with Jill. Thanks so much for being here. Thanks for the work that you do for patients and for employers for the world. Hope everyone will check out your book.